to investigate an outbreak among people who had attended a convention of the American Legion and the Veterans of Foreign Wars. And it was an outbreak, it was a pneumonia, and no one knew what was causing it. And all these guys had been at this one hotel, different hotel story, and they went home, and they all started to get sick, and no one could figure out what the cause was. And that turned out to be what we now know as Legionnaire's disease. And so he described this, and he described the whole process of having been on the job for about a week and being thrown into the middle of this, an unknown disease, people were dying, and the role that he played, 26 years old, just out of medical school, in figuring out what was at that time one of the most extraordinary public health mysteries of its time. I heard that story. I said, I'm hooked, you know. That's for me.
Was getting into it what you expected it to be, and what are the pros and cons of it?
It's been great. It's been great. Any government job, you deal with a lot of bureaucracy. And, you know, but, you know, any job has that. The things that I enjoy the most about it, one is it's never dull. There's something new happening every single minute. And you really do get to meet an awful lot of people. I don't travel much outside the country for a lot of reasons. The work I do is mostly the United States. I've been all over the United States, all 50 states. But a lot of my colleagues, including my wife, who also works at CDC, has been all over the world. She works for the Global AIDS Program. And she has been in about, I think, 40 different countries, in small villages, in large cities. And I think she and I feel the same way. You get to do stuff that you never even dreamed about doing. And every place you go and everything you do, you make some kind of a difference. You're actually helping people in some way. And to me, that's the greatest feeling in the world.
What would you say is your favorite experience that you've had?
Well, the most exciting came like with a guy who's now my friend, who I told you the story about Legionnaire's disease. Shortly after I joined the CDC, they sent me up to Canada, and it's a very, very long story, but I'll make it short, which is that a whole bunch of babies in a neonatal intensive care unit got sick all on the same day, and no one could figure out why. And they shut down part of the hospital. Nobody knew what was going on. These babies were very sick. And it was, again, one of these incredible mysteries. You know, when you join this epidemic intelligence service, they put you through 3 weeks of training. It's now 4 weeks, because you get a week of bioterrorism training, which they didn't have when I started. But I did everything that they taught me to do. I went through the whole thing. And at the end, we use, it's a much longer story than this, but in the end, it turned out to be a hospital error. You've heard about medical errors. In Canada, they had 2 different drugs in the same size bottle with almost the identical label. And the only difference was the tiny print that had the name of the drug. And these nurses, who were just incredibly experienced, on one particular day, one of the drugs was not where it's supposed to be. They usually kept them in 2 different parts of the nurses' station. The drugs got mixed up, and they gave these babies the wrong drug. And it took us a week and a half to unravel what that was. But it was just incredible. And so I ended up being questioned by the Royal Canadian Mounted Police and stuff. I mean, you know, it was, that was about the most exciting.
Hi, I'm Matt Leonard from Lake Catholic High School. I was wondering what national epidemic that you're facing right now that you're trying to improve on, and if you have any future predictions of diseases in the next 15 years.
Yeah. The biggest epidemic in the United States right now is the epidemic of obesity. Americans are getting bigger and getting heavier and getting very unhealthy in the process. The fact that we rank 26th in life expectancy is not solely due to obesity, but it is an important factor. And the causes of that are very complex. But battling that epidemic of obesity, especially among young children, who now in many places are themselves very obese and have a tremendous overweight, that is one of the biggest problems that we're facing, and that truly is an epidemic. Infectious disease epidemics come and go. There's been West Nile and other things, but the epidemic of obesity is the one that is having the biggest impact on the health of the United States right now. In the future, I think we are, whether or not the bird flu is the disease that breaks through and becomes this very dangerous potential pandemic, I'm not sure. There is always a risk of diseases jumping from animals to people. And that's where a lot of these new diseases come from. They're new diseases in people, but they've been in animals for hundreds, thousands, perhaps maybe millions of years, but they mutate and develop the ability to infect human beings. So I think our concern is for the next one. That's what happened with SARS. SARS was an animal virus that mutated to be able to infect humans. The concern is exactly that, is for a disease that is as communicable as the 1918 flu, as virulent and severe in the disease it causes the 1918 flu, and having that happen in a world where that disease can spread around the world as fast as a jet plane can go. That between breakfast and dinner, somebody can be spreading that disease halfway around the world. That's a scary prospect, and we are putting in place things that we think, that we hope are going to prevent that and catch it early. But that's kind of scary.
As time progresses, do you believe that the risk of health issues caused by immoral, intentional means of individuals, such as anthrax, is becoming more predominant?
Bioterrorism agents, for the most part, it's very, very difficult to cause a huge, widespread outbreak of bioterrorism using a bacterium or a virus. You can do some real bad things with it. The 17 people that were infected by the anthrax, and 5 of those people died. It's very difficult, because of the way viruses and bacteria are, of much greater risk. And we're doing a lot to try and prevent that. But if you're talking about large-scale attacks, the real dangers are the chemical agents and the toxins. Things like what are called ricin is an example of one that was used in Japan some years ago in a fortunately poorly run terrorist attempt. And radiation. The risk of terrorists obtaining dirty fuel or of uranium for dirty bombs and things like that. And we have stuff in place, but bioterrorism is always going to be there. It is a risk. We've got a lot in place to deal with it. But in some sense, I think we feel the bigger risks are the chemical agents, the toxins, and radiation.